In this virtual education offering by the Clinical Excellence Commission, we're going to learn about the run chart. Before we begin, I would like to acknowledge and pay respect to the traditional owners of the land in which I'm hosting this virtual education session, the Gadigal people of the Eora Nation. I also acknowledge the traditional custodians of the various lands on which you all work today. We pay our respects to their elders, past, present, and emerging. There's a lot to cover to learn about run charts, so we've broken the video series down into 7 parts. The first part covers the definition and features of a run chart, and we'll also do a demonstration. Part 2, we will interpret the data in a run chart. Part 3 is around the operational definition. Part 4, you'll learn about the family of measures. Part 5 is about data collection, and Part 6, the types of data that are used in run charts. And Part 7 is a quiz to test your knowledge. Learning outcomes. By the end of this video series on run charts, the participants should be able to discuss the purpose and the features of a run chart, interpret the data in a run chart, discuss when and how to use a run chart, create a run chart, describe the operational definition, discuss the family of measures, list the ways data can be collected for a run chart, and describe the types of data used in a run chart. For your information, these are the references that have been used to inform this presentation, particularly the 3 books highlighted in the images. A run chart is just a simple line graph or a time series chart, and it's very easy to create either by hand or in Excel. A run chart shows the manner in which measurement or data points vary over time or between observations. And it helps you to understand the variation in the process over time. The y-axis presents measurement, and the x-axis is either time or observations. Importantly, these are in chronological order, in date order. In a run chart, the y-axis can use different types of data. It can use count data, which is like the number or the frequency of incident cases, such as the number of falls, the number of needle stick injuries, number of complaints or number of pressure ulcers or number of failed to attend. It can also use rate-based data, such as the number of incidents per 1,000 occupied bed days, or the number of incidents per 1,000 occasions of service for outpatients, or the number of central line infections per 1,000 line days. The y-axis can also use classification data, and this is where the data is expressed as a proportion or a percent. And some examples here might be the percent of infections, or the percent of clinic no-shows from outpatients, or the percent of compliance for hand hygiene policy, or the percentage of cancellations. And lastly, it can use continuous or variable data, and this is where the data is a form of measure, such as time, like how long do patients have to wait in hours or minutes or weeks. It could also be money or weight or height or blood sugar level. Also throughput, that's like the number of patients treated or the number of operations or the number of discharges from a ward. There'll be a further explanation of the types of data used in different charts, and this will be covered later on in another section of the video series. One of the great features of a run chart is that you can include annotations. And annotations in a run chart can include the explanations of, for example, change ideas or the interventions that have been tested via Plan-Do Study Act cycles or PDSA cycles. Also to explain the shifts, trends, or astronomical data points, in other words, outliers that you might find in your data. Another feature in a run chart is what we call the center line, and it is a line through the data points, and it's a horizontal reference line. The median of the data set is used to calculate the center line, and the center line is used when interpreting the data in a run chart. So what is the median? A median is one of the measures of central tendency, in other words, finding the middle point in a data set. It's calculated by arranging all the numbers or observations from lowest to highest, and the number or the observation in the middle of the range of data is called the median. It's a very robust measure of central tendency because it's not affected by outliers, and outliers are also called astronomical data points. It's very easy to calculate in Excel, and we've set up some run chart templates on the CEC website, and these already have the median calculated for you. So here we have a data set. The numbers are 2, 4, 5, 6, 7, 8, and a way off figure, or what we call an outlier, of 59. They're ranged from lowest to highest, and the middle figure, as you can see here, there's 3 before and 3 after, so the middle figure is 6 in this case, so the median is 6. Another measure of central tendency is the mean or the average. So a run chart traditionally would use the median as its measure of central tendency, or in other words, the center line. However, you can use the mean or the average, but you can only use it if you have over 20 data points and when there are no outliers. Because the problem with the mean, if there are some outliers, the mean can be skewed. And in other words, it won't give you an accurate measure of central tendency. It's not going to really tell you accurately what the middle point of the data is. So when we look at our data set again, same data set, the way you calculate the average is you add up all the numbers and divide by the number of observations. So here, if you add up 2 plus 4 plus 5, etc., you get 91. And there's 7 observations, which gives a mean or an average of 13. 13 is not a great measure of central tendency in this respect because of that outlier. And that is why the median is a much more robust figure. An optional feature you can include in your run chart is what we call a stretch goal, or the aspirational target for the measure. And this can be placed into the run chart as a horizontal reference line. The line demonstrates visually the target that you're actually trying to achieve in your project for this measure. It can also help you show the desired direction of the chart. So below, we're looking at the percentage of infection rates per month, and the desired direction of this data is down. The stretch goal is set at 1%. And this chart, we're looking at the percentage of elective surgery patients that are screened preoperatively for venous thromboembolism risk. You can see the stretch goal is set at 100% because they want all patients to be screened before they have their operation. And the desired direction of this chart is up. Our aim in healthcare regarding safety and quality for patients is that we'd like to see 100% reliability and 0% error. So 100% reliability, or for example 100% compliance, is really important in healthcare. We'd like to see, for example, that we have 100% of hand hygiene compliance by all staff every day, including the weekends. We'd like to see that all patients are risk screened every day of the week. And we'd like to see 100% compliance to all medical record documentation standards, and also that all accreditation standards are met. So there's a few examples of reliability and compliance. We also like to see 0% errors or no incidents, as these are undesirable patient outcomes. And examples of this are we'd like to see 0 post-operative infections and no patients falling, 0 medication errors and no pressure areas, and we would also like to try to head towards 0 suicides. So 100% reliability and 0% error is important when you're determining the desired direction of the data in your run chart. For reliability and compliance, we want 100% compliance, so we'd like to see a high rate in the run chart. In other words, the desired direction of the chart is going up. And errors and incidents, we want 0 errors and 0 incidents, so a low rate is desirable. So the desired direction of the data is actually down in the run chart. With a run chart, you need at least 10 data points before you can start interpreting the data. You can actually start the run chart as soon as you've got 1 data point, but you need at least 10 data points before you can actually do any form of interpretation. So along the x-axis, you need at least 10 days worth of data, or 10 weeks worth of data, 10 fortnights, or 10 months, or at least 10 patients in date order, or at least 10 audits or observations in chronological order. So with a run chart, it's best to report on small amounts of data on a regular basis, rather than waiting for months and months to plot the data in a run chart. So in other words, it's not really advisable to collect and report data on a quarterly basis. So what is a run in a run chart? A run is 1 or more data points on the same side of the center line. A run can be a cluster of data points or just 1 data point. and the number of runs is used when interpreting the data. We'll discuss this in detail later on when we talk about the run chart rules. An optional feature to a run chart can be the use of traffic light indicators or icons. These can help to assist your audience to quickly understand the progress of your project. Some executive or board members really favour the use of these indicators, particularly if they've got huge agendas where there's lots of information in the agenda papers and they want to quickly interpret or decide what they would like to focus on. The traffic light icons are very subjective and the whole team needs to agree where and when they should be placed in the run chart. But please note some organisations do not support the use of these traffic light icons or indicators, so seek advice from your audience or your organisation first before you use them. Another great feature of a run chart is being able to phase the centre line. So you can recalculate the centre line to see if a change has resulted in an improvement. In the case we're looking at here, we've got sepsis patients in an emergency department. We're looking at the minutes from diagnosis of sepsis to the administration of the first antibiotics. The PDSA was done around patient 32. So what we've done here is we've phased the median line pre-patient 32, in other words, pre-intervention and also post-intervention. And you can see that the median has gone down from 110 minutes to 57 minutes post-intervention. And this is desirable because we want the data to be heading down towards zero, or towards a stretch goal of 60 minutes in this case. So phasing in Excel, the centre line column can be recalculated to reflect the new or phased median. So if you see row 43 in this Excel sheet, this is for patient 32. So you have a median pre-patient 32 and post 32, it's been recalculated. Run charts can be displayed in a series of what we call small multiples. There's two ways you can do this, either the same measure and scale for comparison in different charts or with multiple measures in a single chart. So the example to the right is small multiple showing number of falls in 4 different facilities. So we've got 4 different charts here. And for ease of interpretation and comparison, the y-axis in this is the same in each chart. This next example of small multiples, we have one chart which contains 3 measures, and what we're looking at here is compliance to the bundle of diabetic care. With this example, they could take it one stage further and include the median line for each of the 3 measures. So in quality improvement, we'd like you to avoid using simple pre-post intervention bar graphs. It's much more preferable to use a run chart measuring data on a frequent basis. In other words, reporting your data either weekly, fortnightly, or monthly. We'd like you to avoid a simple pre-post test. A simple bar chart of before and after test can be very misleading. So what we're going to do is review the bar chart on time delay, and on the next slide we'll review this graph to see if it accurately demonstrates that a change is an improvement. So this bar graph is depicting some measurement from a project that was done over several weeks. They were looking at time delay in hours and the desired direction of the data is down. On week 4 they did a measure and also on week 11. And they made some changes on week 7 and 8. In other words, they tested some PDSA cycles. So what we're going to do now is we're going to compare a pre-post bar graph to a run chart where we measured frequently over time. So if you look at the bar graph, did the change between week 7 and 8 result in an improvement? In other words, we want a low rate, we want reduced time in hours. So it's gone from 8 hours, then we made a change and it's gone down to 3 hours, which we'd say that was an improvement. So we'd think with this particular graph, it demonstrates improvement. Okay, we're now going to look at the information that when it's been plotted in a run chart on a more frequent basis, in other words, measurement over time. Here's your run chart. It is exactly the same information, yet this team has collected and reported it weekly. So again, week 4 was 8. Week 11 recorded a time delay of 3. But now look at this question. Did the change between week 7 and 8 result in an improvement? In other words, we want a low number. We want to reduce the time in hours. So if you look at that information, it's actually not an improvement because that number, the time delay, is going up. I'm now going to discuss some chart setup ideas and labeling suggestions. This is also known as chart hygiene. So on your run chart, you need to clearly state the title of what's being measured and where it's being measured. Also the type of chart it is. This is optional. You can just say it's a run chart. The definition of what's being measured. So you could state the numerator and the denominator, but you might also like to give a definition of what you're actually measuring, such as a fall. What does a fall mean? Or what is a pressure ulcer? You also include a legend to state the names of the lines in the chart, such as the center line, the measure, and the stretch goal. You can also state the data collection period if it's not apparent in the x-axis. In the example here, it is apparent we've gone from January 2018 to January 2020. You need to label the y-axis just because we need to know if it's a count or a rate or a percentage, or it might be a measure such as throughput of patients or wait times in minutes, hours, or weeks. So you always need to state what the y-axis is. Also on the y-axis, the numbers should be whole numbers. You don't need to make them to any decimal points. Also include the annotations to indicate your PDSAs and other effects on the data. Some more chart hygiene tips. The dots along the measurement line in the run chart should be apparent. We tend to use a blue line with a red dot so that those data points really stand out. You should always have a center line in your run chart, and in the legend you can state whether the center line is made up by the median or the mean. An optional line is the stretch goal line, that aspirational target that you're trying to head for. And also you can use the icons to express the desired direction of the chart, whether it's up or down. You can also use these traffic light indicators, such as the green, amber, and red face, to demonstrate how the team feels the data is tracking along the run chart. These are very much optional, and some organisations don't like them being used, so use them with caution. You can also paste in an image of the data along the x-axis, and this states the numerator figure and the denominator figure, just for clarification about the numbers. You don't want to see too much white in your chart, and you may need to alter your y-axis so that it starts and finishes near the minimum and maximum values. So you can see with this chart here to the right that all the data is right down the bottom of the chart. So that's actually too much white. That's what we call it, too much white in the chart. And without making the chart too busy, it's a good idea to try and include all relevant information in your chart to reduce the queries or questions about your data and how it was collected or how it was reported. For example, it's a good idea to state the numerator and denominator so that people know how you calculated the percentage. I'll now show you how you can create your own chart using the ready-made templates on the CEC website. You can easily create your own chart using the user-friendly ready-made templates on the CEC website. And we have two different systems where you could do this. Either on the Quality Tool web pages, and you click on the chart that you want, and then there will be an Excel template for you. Or you can use the Quality Improvement Data System, or the QID system. You'll need to be registered to access the QID system by your local QIDS coordinator in your LHD or your network, and this is for New South Wales Health staff only. To get to the CEC Quality Improvement Tool webpage, you could use this URL or go to the website and the menu Quality Improvement Academy and Quality Improvement Tools. So this is an image of the Quality Improvement Tools webpage on the CEC website. And here are the different quality tools. And you click on the tool that you want, and there'll be information about that particular tool and the Excel templates. We have Excel templates for run charts, Pareto charts, histograms, and scatter plots. For New South Wales Health staff, there's a system that you could use to create charts. This is called the QID system, or the Quality Improvement Data System, and you'll need to be registered to use this system via your LHD or network. You can find the login through Quality Improvement and then go to the QIDS and QAS section on the CEC website. When you're into the QIDS system, you need to click on Improvement Projects, and that will take you through to the chart templates. When you're in the Quality Improvement section in QIDS, You click on Charts and New Chart, and up will come a range of charts that you can choose from, such as a run chart, control chart, Pareto chart, histogram, or a customized chart. When you select Run Charts in Quids, up will come some templates. The template that you choose depends on the type of data you have. If you have continuous data, such as a measure like time or throughput or height or weight or money, you'd use the continuous data template. For attribute data, you'd use this if you have a count, like the number or the frequency or the percent. And the run chart rate template is when you have a rate per 1,000 or a rate per 10,000 or a rate per 100. So using the Quality Improvement Tools webpage, we're now going to demonstrate how easy it is to create a chart using Excel from one of the templates that have been set up for you. When you open up the Run Chart template in Excel, you'll see various tabs or sheets. The first one is the actual templates where you can enter your data and the chart will grow automatically. Then we have some examples of run charts, how to interpret a run chart. And then there is a tab regarding statistical process control charts and the templates that you use for QI macros. And then there's some instructions on how you can manually create a run chart from scratch. When you have some data, the next step is to create a run chart in Excel, and you can either use the templates on the CSE website or in the Quids system. When you open up the Excel run chart template, you scroll down past the definition and instructions, and what you'll find are several table templates and their corresponding charts. You need to decide which table template to use, which will depend on the type of data you have. So if you've got percentage data, count data, or rate-based data, there are particular tables to use. Or you've got continuous or variable data, such as a measure of time in hours or minutes or weeks, or money or throughput. There are other templates there to use. All you do is simply key your data into the appropriate template, and the corresponding chart will build automatically. Then you need to follow the instructions to tidy up the chart. In other words, do a bit of chart hygiene. So what would you key into the tables? So for this example here, we're looking at the number of fall incidents by month. So in this column, we would put in the dates, the months, and then the next column we'd put in the number of incidents and actually name this column, say it's number of fall incidents. Then you can put in your stretch goal, which we've got here as 2. The areas in grey, they actually don't need any information keyed into it. They are already set, so don't touch those. Then you can also put in here your change ideas that you tested via PDSA to keep that as a record of what you did and when. Then with your chart, you go into your chart, which will have grown and built automatically. You key into these little boxes, these annotation boxes, the exact information about each PDSA. Then also put in the title and also the definition of what you're looking at if you think that is required. And it's as simple as that. I'm now in the run chart template, and there's a definition of what a run chart is, and then there's the steps to follow to build your run chart, and then there's different templates. This is a run chart if you've got percentage data, in other words, classification data where you've got a numerator and denominator. This is one where you have got count data, or looking at, say, the number of incidents in a time period. This template is when you want to use incident rates per 1,000 occupied bed days, for example. And this template is for continuous data, such as the measures of hours, minutes, time, height, weight, volume, or throughput. I'm just going to do a demonstration on how easy these charts grow when you enter your data. So we're just going to continue on here. Excel is clever because it can follow a pattern. So there are the months for the chart. I'm just going to put in some data. I'm just going to make this data up. You can see the graph growing automatically. Then if you click on the chart, then you need to put in the information about your PDSAs and when they occurred. You can move those around. Also, you'll need to give it a title. And here we've put the definition in already that what a fall actually is. So that's how easy it is to create a chart in Excel using these templates. If you'd like to create your own run chart from scratch in Excel, follow these instructions from A to L, so you don't have to use the templates in Quids or the templates on the CSE website. Now it's over to you. We're going to do a short exercise where you are going to create a run chart. So in this exercise, we'd like you to create a run chart using the information below. And you can either do this by hand, so draw it by hand, or use Excel. So the information we'd like to see in your run chart is the title, the definition of the numerator and denominator, the data below, and also include a median line, stretch goal line, and an annotation regarding the intervention. Good luck. You can plot the data by hand in a run chart. You don't necessarily need to use Excel or any fancy software. And this is a great way of getting your team or your staff involved in the quality improvement project. So I'm now going to show you the answer to this exercise, and I'll reveal what the chart should look like. So basically this should be the shape of the data in the chart that you created, and make sure that you had a title, the numerator and denominator definitions, the median or the center line, and a stretch goal. So just study this and compare it to what you created to see if you're on the right track. This is the end of this section in the Run Chart education session. Please go to the next part of the Run Chart series to learn more and to complete the quiz at the end.